Hey there, David from Bodyworks here. Today we are going to talk about shoulder pain, and mostly generalized shoulder pain, but we're also going to talk about a few different types of other pain that you should know about, and when it might be something more serious and when it might just be postural muscle imbalance pain, which we can absolutely help with massage therapy. Let's get to it. Shoulder pain is super common, and the shoulder is actually one of the most mobile joints in the body, but that actually makes it the most vulnerable joints in the body as well. The shoulder is really designed for massive amounts of movement. You've got the ability to roll what we call the shoulder girdle, which is one of the two joints of the shoulder, which is the position of the shoulder blade and the collarbone on the rib cage. So the ability to move the position of your shoulder in space, that's the shoulder girdle. And you've got the shoulder joint, which is the humerus in the cup of the scapula, the glenoid fossa, and the ability of that ball and socket to move this bone in space. And that whole thing really is designed for this massive amount of 360-degree movement in all sorts of different directions. And having that level of mobility is quite useful to us in life, but it also, the more mobility that you design into a system, the less stability it has. And the less stable a structure is, the more vulnerable it can be to injury, and either by impact or by long-term repetitive stress or postural imbalance. And shoulder pain is a really good example of something where, because it's so designed to be able to move, any restrictions in that movement are going to show up as potentials for achy pain or chronic pain. And then there are some more serious examples we'll talk about later. But in general, the way that I think about treating shoulder pain is a few different things. We talked about this in the head video, the head and neck video. We talked about this a little bit in the generalized low back video about how the muscles complaining have so much to do with where the position of the bones are in space. And if the bones are not in an efficient place, the muscles have to overwork to hold them up and hold them into space. So if you've got, for instance, a head forward posture, it's very hard to have relaxed shoulders here, because if you do, that pulls even more on your neck muscles. And so that's going to make the shoulder girdle roll forward to release your neck muscles to some degree. You would think with all this pain, this is now going to overstretch your traps back here and overstretch your rhomboids, and they might be the thing yelling at you all day. You might feel it here, feel it out here, and you'd think that rubbing back there would be the thing that would help, but it's only going to give you a very short-term relief, because if I rub back here, all it's going to do is encourage even more rolling forward. So what I actually need to do is open the front of the body and open into here, and by doing that and allowing the head and shoulders to come more into a neutral position, all the muscles get to relax and all of the muscles calm down. And so this is something that comes up time and time again, that often the place where you feel pain isn't the root cause or the thing that should be released. It's actually the opposite side that actually would benefit you more if we worked on it. And for shoulder pain back here, just like I talked about in the back video, where I might counterintuitively have the client face up the whole time, for shoulder pain back here, I might also have the client face up the whole time and work on opening this up, and that's going to help the shoulders to relax backwards and calm down and relax. Again, counterintuitive, but it works a lot. Doesn't mean I won't put you face down if I meet you for the first time, but it just is to say I wouldn't have to. I could absolutely get your shoulders to relax and stop yelling at you without ever putting you face down. Okay, so some basics, right? You've got 3 basic bones to your shoulders. You've got the humerus, which is your upper arm. You've got your scapula, which is your shoulder blade, and you've got your clavicle, which is your collarbone. And all of that has only one true attachment to the rest of your skeleton, not through muscles, but through ligaments, right? We think about skeletal attachments as ligaments attaching bones to other bones. The only place your shoulder attaches to the rest of the skeleton is right here, where the collarbone actually has ligaments that feed in and fuse to the sternum and the first rib a little bit. Technically, there is a big giant ligament between your shoulder blade and your fourth or fifth rib, but it's super loose and you could really pull the shoulder blade right off the back if it were just that trying to hold you there. And it's really only meant to keep your shoulder blade from literally be ripped off your body completely. But if it were super tight, you wouldn't be able to move at all. You wouldn't be able to do anything like a shoulder roll because you really need that ligament to be super loose to allow for that movement. So it's not a true joint like we think of bones attaching bone to bone. The only place the shoulder really attaches to the rest of your skeleton is here, which is very counterintuitive, right? This is a very tiny joint compared to this giant shoulder structure. And you can imagine if this is the only place that's structurally fused by ligaments, which are the densest, tightest tissue that we have, it's not very stable, right? Something like your knee has a bunch of two bones right next to each other with a bunch of big ligaments holding them together. Yes, absolutely, muscles are involved as well in structurally holding that together, but even without the muscles, that joint is pretty tight. Not so much with the shoulder, right? The shoulder is very, very open and only attached right here. I'll say this over and over. It's only attached right here. That's a very small, not very strong joint. And therefore your shoulder is super vulnerable to injury. And you may get injuries that we'll talk about, like rotator cuff tears or biceps tendonitis or acromion dislocations, and all sorts of different things. So that's the basic structure from a skeletal standpoint. Let's get a little bit into the muscles that are involved. We're not going to go in them fully because there's a whole bunch. But again, that's just what I was talking about here. You can really see you've got humerus, shoulder blade, clavicle, and that is attached right there, and that's really the only place that's fused to the rest of your skeleton. So you can really imagine that little tiny joint holding all these bones. That's not very strong. All right. Okay. So then we get into some muscles here, right? And you can really see how that structure back here has a bunch of rotator cuff muscles. There's the rhomboids here, deltoid on top, and then traps layered in, and then lats, which are actually go all the way down to your sacrum, right, and come all the way up and fuse right there. So low back and shoulders are pretty interconnected. And that's all just on the posterior side. On the anterior side, you've got pecs. That's the major one, and pec minor, and then there's another little guy under here called subclavius. And that's all gonna essentially affect either the position of the shoulder blade on the ribs or the position of the ball in the socket. And different muscles do different things. And I'm not gonna try to get that level of anatomy for everybody, but I did want to show this specific image to really highlight the connection of the shoulder all the way down to the low back. And so this is your lat muscle, very big, dense muscle. Comes all the way up and attaches here from under, and then goes all the way down and attaches to all of your lumbar, the top of your pelvis, and your sacrum. And so shoulders and low back, very interrelated. Last but not least, because lots of people talk about the rotator cuff, let's actually highlight what that is. And that all affects the position of the ball in the socket. And you got four of them. You've got supraspinatus, infraspinatus. So supraspinatus is the top of the shoulder blade. Infra is this giant pocket below on the bottom. Teres minor is from there to there, and then subscapularis is on the front side of the shoulder blade, between the shoulder blade and the ribs. And all these three all do external rotation, and the subscapularis does internal rotation. Pitchers, football, quarterbacks, tennis, anybody who's doing a lot of like throwing, swinging, you often hear about them, you know, blowing out their rotator cuff, which might mean that like one of these muscles has been really severely torn. Okay, what else now? So that's bones and muscles, basic anatomy stuff. Let's talk about how they connect together a little bit. And I'll bring out anatomy trains, my favorite guy, Tom Myers, and he talks about these long fascial chains where big like muscles connect to each other, even though they're technically different muscles, but they're all existing along these chains that functionally provide different directions of movement. And so there's several that go through the shoulder itself, but I'm going to highlight one of my favorites, which is the spiral line. And the spiral line has a lower part, which we won't talk about right now, and an upper part. And the upper part attaches to the pelvis and then wraps around in a big spiral. All right, and so that goes internal obliques to external obliques, wraps around to serratus anterior, which is this big giant muscle you see in comic books on the side that look like fingers. Serratus pulls the shoulder forward, so that wraps around there, comes through the rhomboids, and then up to the top of the head through a muscle called splenius capitis. Now, what I love about this idea is especially, let's see if I can find it, okay. So this is the whole spiral line dissected out. And so if your shoulder is stuck here, yes, absolutely, I can work locally right here, but I also might work way down at the opposite hip and open up in a line to let that roll backwards. And you can really see here that really serratus anterior and rhomboids are almost like one giant muscle with the shoulder blade splitting it in half. And the position of that split is how tight one or the other side of that is. So rhomboids tightening will pull the shoulder blades back towards the spine. Serratus tightening will pull it forwards. And so balancing the position of the shoulder blade is going to have a lot to do with which side of the spiral line is tighter than the other. And you can do a lot to open up the shoulders by working through the lower abs in those spirals and then working up through serratus. Most of us are rolled forward as opposed to like pulled back. But so I wanted you to see this idea that serratus anterior and rhomboids could be thought of as just one muscle with the shoulder blade splitting it in half. Okay, so last but not least here, this is Tom Myers' arm lines here. And I would always say that shoulders are going to affect arms, and getting the shoulder position into a natural place will often let arm issues resolve themselves, but sometimes the arm fascia itself and the arm muscles are so tight that they're actually pulling into the shoulders. If you're doing a lot of this kind of stuff and your arms are stuck this way, you have two choices. You rest your humeruses backwards and then look like a robot, or you let the shoulders roll forwards to bring your arms into what feels like a more side position. If I relax the shoulders, all that's going to happen is that humerus is now in a neutral place, but the lower arm isn't. And so working up through biceps and working into the forearm can absolutely affect how your shoulder position sits and whether your shoulder is relaxed and happy. And so while I might not do the whole arm in session 1, if I've gotten some relief in the first session with shoulders, I probably want to work the rest of the arm line in sessions 2, 3, or 4, depending on the client. So I just wanted you to see that that relationship really goes all the way up and all the way down and even down here. And there's a good reason for that. If you come back to that idea that this is the only real true skeletal attachment of ligaments, you need a lot of muscles holding it in place. Otherwise it would just literally fall off your body. And so you've got way big chains of muscle all the way down to the pelvis, all the way down to the arms, all the way down to the back, that need to be there to anchor the shoulder and keep it on the body and keep it functionally able to work. If the only real skeletal attachment is this tiny little joint here. Okay. Last but not least, let's look up what Ida Rolf has to say about some of this. I love these images here, and here you really can see how serratus and the back line of teres in the rotator cuff, and here's pectoralis minor, all of that is basically different little angular guy wires. Each one of these, if it fires, will pull the bone of the humerus into a slightly different angle depending on which one's firing and what balance. And so anytime you have one global concept I should put in place here is the idea that really big muscles are for power and little thin muscles are for balance and positioning. And so here you've got this giant pec that's going to be, you know, obviously for push-ups and lifting, and you've got this really big deltoid for lifting this arm in this direction, but these underneath that are all about fine-tuning the angles that happens at. And sometimes what'll happen is the little muscles get stuck because the big muscles aren't doing their job properly. And so rebalancing and getting those to each do their job correctly often can provide tons of relief. All right, and last but not least, I love this image. So serratus, which looks like this little thing in comic books or out here, is actually this huge, giant muscle in here. And you can really see how this anchors to each of the ribs. And I'll say this, shoulders obviously anchor to ribs, but we never really think about what that really means, which is that if there's anything going on with your breathing, anxiety, PTSD, just general stress, and your breathing is restricted, your shoulders are going to restrict as well. And so a lot of times we can get the shoulders to relax, but if we don't work on diaphragm and rib cage movement and getting that easier, that tension is just going to go right back into the shoulders. And I wanted you to see how it's undeniable here with this image of serratus just how much the shoulder is anchoring to the rib cage itself. And so a lot of homework assignments I might give to a client when they get their shoulders relaxed is to breathe fully and sideways into the armpits to get some movement into those muscles so that they don't just seize right back up again. And conversely, I could tell you, relax your shoulders, and that might not do anything at all, but telling you to breathe into your upper rib cage will have the same effect. And here you can really see how complex the musculature is underneath everything. So the traps are these giant muscles from here to here and here. They really do attach all the way up on the head. That covers over underneath a much more complex layering of muscles in different angles in different directions. And so a lot of the work isn't just about getting muscles to relax or soften, it's about getting different muscles to glide properly and not get stuck to each other so that there's better functionality. So that's rough overview. Let's go into everything we've talked about up until now is roughly talking about generalized shoulder pain due to postural imbalances and muscular imbalances where one muscle is underworking, another is overworking, and the overworking muscle is screaming and complaining at you. Or sometimes the underworking muscle is overstretched and screaming and complaining at you. That's very easy to work on with massage therapy. It absolutely is something that can be resolved relatively quickly with massage therapy, and then we probably need to work on all the rest of the alignment of the skeleton in order for that relief to stick long term. However, there are some injury examples that get more than just, or they go beyond just muscle imbalances, and so there could be stuff like, frozen shoulder. We have a video on that here, where the capsule that holds your ball into the socket like gets so adhered that it stops being able to move. That can be highly, highly painful, and it requires a whole different way of thinking about it, usually involving physical therapy along with what we do. There can also be dislocations where the ball gets pulled out of the socket completely, or labral tears where that it's not just that the capsule is frozen, it's actually that the ligaments that hold the ball into the socket either partially tear or even worse, fully tear. And in those cases, that's potentially going to require some sort of surgical intervention to tighten and create a good stable structure for the shoulder, either replacement or even a full shoulder replacement. And then what we do combined with physical therapy to tighten the structure back up. And we do lots and lots of work with shoulder replacements, post-surgical, obviously, recovery for shoulder replacements. So those are some examples of some slightly more serious things that might be happening. Again, if we're working on you and you're not aware of those things and we don't seem to be getting anywhere with the normal work we do, we would very likely want you to go in and get some imaging to see if there's some structural issue to the shoulder that needs to have some either physical therapy, surgery, or both to work on it. And that really does come back to that idea that structurally, it's a very vulnerable joint. It's actually much easier to tear things that should be not torn, not just muscles, but ligaments, cartilage, capsules, all sorts of different things can happen to the shoulder that are much more likely here than some other joints in the body. So if we do work on you and we feel like, yeah, this should have been resolved, but it doesn't seem to be helping much, we are very likely to ask you to go and get it checked by either an orthopedist or a physical therapist, and then work together with them to help you get better faster. I'm gonna pull in, so this is our website. We're talking about shoulder pain and rotator cuff injury. Rotator cuff injury might not be that big a deal because it can sometimes just be muscular. But I thought this was an interesting point here. So the shoulder is the body's most mobile joint and one of the most injury prone. Rotator cuff tears are very common. 30% of adults over 60 and 60% over 80 have one, whether it has symptoms or not. And that's sourced from the National Institute of Health. And so those are some issues that we can deal with, and again, some that we run into where we might need to have you work with somebody else alongside of us. So, if you're dealing with shoulder pain and you're in New York City, absolutely feel free to book a session with us either by calling or online, and we'd love to work with you. Have a great day.